At the point when it comes to experience of difficulty having a child, there is around a possibility that the man has an issue adding to the pregnancy. The chances are sperm scarcity to fertilize an egg, sperms that are not molded appropriately or that don't move the manner in which they ought to be, or a man has a blockage in his conceptive tract that shields sperm from getting out. In the event that you may have a fertility issue, your primary care physician will need to play out a total history and physical diagnostics and just as few tests to discover what might be causing your infertility. One of the first and foremost steps that a specialist can start with is semen analysis. Semen examination is most likely the main test you will be approached to perform. Semen is a liquid that is discharged when a man has a climax. Semen conveys a sperm in liquids that ought to support and secure it. You will ordinarily be approached to give a semen test by stroking off into a sterile glass container. On the off chance that masturbation isn't socially satisfactory, your primary care physician can give you a unique condom where to gather semen during intercourse. The semen investigation gives a great deal of data about the amount and nature of both semen and the sperm it contains. A portion of the things that are estimated are volume, how much semen a man produces, absolute check, the all-out number of sperm in the semen test, fixation, the quantity of sperm in every milliliter of semen, motility, the level of sperm that are moving, morphology, if the sperm are the correct shape or not. The examination can also propose if you have a disease in your reproductive organs. The semen test must be tried inside an hour of assortment, which as a rule happens in the specialist's office. You will presumably need to make 2 visits to give tests on 2 unique days over about 14 days separated, in light of the fact that examples from a similar man can be diverse at various occasions. Gathering 2 samples makes it simpler to tell if something truly isn't right. You might be asked not to discharge sperm discharge for 2 to 5 days before you give a sample. Significant chemical in your body called hormones control sperm creation. They additionally influence your desire for sex and your capacity to engage in sexual relations. To an extreme, excessively little of these hormones can raise issues with sperm production or trouble having intercourse. Follicle-stimulating hormone and testosterone are 2 important hormones for reproduction. Your PCP may do blood work to verify whether you have the perfect measure of these hormones. Whenever demonstrated, your primary care physician may check other hormone levels, including luteinizing hormone, estradiol, and prolactin. In the event that the semen examination test results aren't normal, you may need to have more tests that can be performed by your primary care physician, or you might be referred to a urologist. These tests will appear as vital staining tests where enough sperm in the semen tests are alive, anti-sperm antibodies tests where the antibodies have attached to sperm, making it difficult for the sperm to move appropriately, peroxidized staining, and semen culture on the off chance that you have a disease or aggravation that influence your semen. If you have had the test portrayed above, yet your primary care physician, despite everything, doesn't have the idea why you are having issues, extra tests might be required. These tests will tell your primary care physician when that the external layer of the sperm is broken or flawless, hyposmotic expanding test, or that your sperm are moving in the manner in which they should, computer-assisted semen investigation, in the event that such a large number of your sperm have broken or frail DNA, sperm DNA testing. If you produce not very many sperm, or in the event that you produce no sperm, your PCP might need to perform a genetic test to check whether there is anything irregular with your genes that makes it not possible for you to produce sperm. These tests can likewise tell if there is an issue that you could give to a child. Moreover, they will tell your primary care physician when your sperm have the right number of chromosomes, sperm aneuploidy testing, and you have a chromosome defect, chromosome investigation, or potentially Y chromosome iterator testing, on the off chance that no sperm are seen, decide whether the sperm tubes are flawless or play out a biopsy of the testicles. When there is no semen test needed, it can completely foresee fertility. However, if you have any doubts and concerns regarding to your fertility, it's always a good idea to be checked out by a specialist.